Welcome to today's webinar, Moving Forward Through Transition, Lessons to Stay Nimble in 2021, the final webinar in our Leadership Through Crisis series. Virginia Mason Institute is a mission-driven nonprofit education and training organization that helps organizations worldwide create cultures of continuous improvement. My name is Tad Akwat, and I'm pleased to introduce today's expert panel. Val Ferris is an executive sensei here at Virginia Mason Institute. Her passion is to work collaboratively with leadership and teams to improve quality for patients and staff. Prior to her work here at the Institute, Val's leadership experience includes perioperative and procedural services, emergency department, hospitalist services, and Kaizen promotion office. Robbi Bishop is a senior transformation sensei here at the Institute. In his 19-plus years at Virginia Mason, Robbi's experience includes direct patient care as an audiologist, leadership within the Kaizen promotion office, along with operational leadership in oncology, perioperative services, and ambulatory care. Melissa Lin is a transformation sensei here at the Institute. She coaches and guides healthcare leaders and providers worldwide through their cultural transformation toward lean as their management method. In today's webinar, will be hosted again by Chris Backous. Chris Backous is a senior transformation sensei here at the Institute, and he leads improvement activities, workshops, and training for healthcare leaders and providers worldwide. You're encouraged to ask questions throughout the session today using the GoToWebinar question tool. Today's session will also be recorded, and you will receive a link to the recording and Q&A transcript via email following this session. Thank you so much for attending. And before I hand it over to Chris, we have a special message from Virginia Mason Health System Chairman and CEO, Dr. Gary Kaplan.
Welcome back to our Virginia Mason Institute webinar series on leadership through the COVID-19 crisis. It's a privilege to have a chance again to say hello and wish you well, share ideas as we continue to address the challenges and frankly the opportunities and silver linings that have come from this tragic COVID-19 pandemic that's impacting all of us both here in the United States and around the world. One of the things that we've learned as we've gone through this since early March, so it's been many months now, is the power and the importance of a management system. As we stood up our command center, we used our Virginia Mason production system principles, the common language. We mapped the workflows and the value streams on our command center walls to create a visual workplace. And the results have been really gratifying. Because of the management system, we were really able to accelerate our work to within days, stand up new isolation units with reverse airflow that was safe for our COVID-19 patients and safe for our staff and other non-COVID patients in our hospital. We were able to convert the vast majority of our ambulatory visits to telemedicine and telehealth. I believe that the deep understanding of our workflows allowed us to really jump the curve, to move from dabbling in telehealth to really systematically putting it in place in every single service line. This couldn't have happened as rapidly as it did without our management system. And finally, I think with or without COVID-19, the imperative of continuous learning, to being a learning organization, and to being curious, continuously learning leaders. That's what's going to make our organization successful. The world around us is changing at an unprecedented pace. But what the management system does and what the leadership of the management system allows is the ability to be nimble, to be flexible, and to quickly adapt to the very complex challenges that are here today facing all of us in healthcare and promise to be here tomorrow and in the years ahead. We think this management system is all about sustaining the excellence of today, but building for the excellence of the future. So Thank you again for joining us in this webinar series. I'll look forward to many more opportunities to share ideas in the days, weeks, and months ahead.
Thank you, Gary, for that message. Now I'd like to hand it over to Chris.
Well, hello, everyone. It is so good to have you back. This is the third in our series, and today's a fun day for me because I get to interact with my colleagues and just share lessons from our initial experiences at Virginia Mason on the Gemba, as well as what we've experienced in delivering differently and what we've experienced in helping our clients continue to respond and continue to move through the crisis to really what's amounted to a reset, not a stopgap measure, but we've now changed the way we do our work, and we will probably move forward from this. So it'll be interesting to hear. Robbi and Val actually had an opportunity to be part of the operational experience of Virginia Mason at the beginning. And I'm wondering, Robbi, if you wanted to just kind of start from an insight perspective, what was it, because you were still operationally accountable for some specialty areas. You want to talk about what it was like for you at the initial onset and then how that evolved?
Sure. So I had the privilege of being the director of general thoracic and vascular surgery. So it's a large clinic ambulatory setting. We have services in multiple buildings downtown, and then had providers who went to regional medical centers. You know, that's a great question, Chris, because it reminds me of what we all were experiencing in the beginning of COVID, right? There was a lot of confusion. The things we take for granted now, just the importance of social distancing, the importance of masking, the importance of washing our hands, not all that was apparent in the beginning. So if you put yourself in the shoes of a patient, they're trying to balance their safety with their medical condition, right? So for us, we were working to conserve PPE and to conserve hospital beds for potential spikes with COVID patients. So a number of surgeries had to be paused. And so patients were having to balance that, right? And then as an organization, we were balancing changes in demand. So we were seeing some areas with significant spikes, like the emergency department. You know, I like to say cancer doesn't stop for anyone. So our oncology services kept going. We saw those services still needing a large team to support them. And some of our medical specialties, where some of our surgical and procedural specialties saw a decrease. So we saw the changes in demand. And then just as an individual frontline team member, the things that people had to deal with, right? So they were worried about their safety, but they were also balancing that with their mission to serve others, right? And to come to work and to serve others. Things were changing on where they worked, how they worked, when they worked. All of those things were changing to meet the demand. And then just life, right? So the life of now our kids are having to do remote learning, or our spouse might have been, you know, furloughed or laid off potentially. So you're balancing that. How I get to work is changing because our bus system was changing in Seattle. So people were coming into it with a lot of evolution and a lot of newness to it, and just the anxiety of the safety. A quote that I've used over many, many years to help myself and to help my teams is, I think it's, everybody is fighting a battle that you know nothing about. So be kind always. I think this was great for me and my team as we were working through this. Is I don't know what's happening in someone's personal life or the challenge that they're facing. So let's use our respect for people principles as we move forward, right? So
Right.
that's really a good perspective to start with, is all the things that were happening and continue to happen for people, is we have to be kind, we have to work with each other to get through it.
Mm-hmm. And you know, that's such a good point about the respect for people elements. And we know that one of our 10 elements of respect is to share information. And one of the things we heard earlier in one of our first webinars with Dr. Kaplan was the importance of information that was changing daily.
Yeah.
And those structures. And Val, I know that you were part of the hospital daily safety huddles that we had, and how that standard work of having that in place really allowed for kind of a nice connection to the crisis response. Can you speak a little bit about the importance of having that structure in place and how that really helped us just move right into responding to this crisis?
Well, thank you, Chris. So I served in a role with the executives of the hospital command center that supported the incident command center. We're a 240-bed hospital. And like you said, Chris, I think the thing I was struck with and I was grateful for was the structures that had been in place as standard work prior to the event, which kind of lead to the ideas of daily management and cross-functional management. As you said, the very strongest piece is this daily safety huddle. And I'm sure many of you in the audience have that, or some maybe have different parts of it. We have a safety huddle that has cross-functional management from clinical, operational, support services. And so what was really great was that as the incident command center was getting up, the information could go right to the safety huddle that day and then create communication and standard work that led into daily management at the unit level. So immediately had that. And from that, different huddles occurred. And for the hospital command center, we did the same thing, did daily huddles in the beginning of the day, end of the day, that then synchronized with the incident command center so that standard work and communication could come out. I reflect on that time, and I think every day there was a different piece of standard work that came out that was revised every day because there was so much we didn't know. We utilized daily huddle cards and those pieces, but that safety huddle, which was a really transparent way to share information earlier in our experience, just served as a great piece for there. And I know that many of you found that when you were working with your management system, having that huddle structure was critical.
It's such a good reminder of that very famous quote that we use often from Teiji, without standards, there can be no improvement. And Melissa, you and I have both had that opportunity when the crisis hit. Not only did our work change, but we were the first people called by our clients. I think that really speaks well to the kind of trusted advisor, trusted relationship we have that, at times of great uncertainty, they reached out to us, not only for the Virginia Mason experience that Robbi and Val can represent for us, but also just, is there something that you can do to help us, from your expertise? And I don't know about you, but I think one of the first things I had to remind people is you have systems in place. You're just not using them for the crisis, but you can use them for the crisis. Did you have any conversations early on with any of your clients on that?
Yeah, that's a great question. I think consistently, client to client, past and present, there was consistently a reflection about, how they could rely on some of the tools and the concepts that they had learned from the Virginia Mason production system. And most specifically, time and again, it was the general concept of daily management. And so many of my clients personally were talking about how they had, to Val's point, huddles previously in place, or they had visual management boards that originally was meant to manage the work that they typically were accustomed to, whether it was on an inpatient floor, if they were a corporate service department. And then when COVID hit, they kind of looked around and said, how can we reconfigure this board? There's a portion of our work that is no longer emergent. It's not at the front of mind for us, but we still have other things we need to do to respond to the pandemic now. So how can we rejigger some of that, those boards, or how can we modify our huddles that we had in place? So it was really, really great to hear folks kind of thinking about, okay, well, where can we rely on some of the previous things that we put into place because of the world-class management system. But there was also some opportunities where I think people have also reflected on, wow, we thought we knew our business, and that was supposed to be the point of daily management. And golly, we have no idea how much PPE we actually have. We have no idea where it is. We have no idea who has a surplus in one corner of the hospital versus others that is complete dearth of PPE whatsoever. So there's just been some reflections as well of panic purchases because they didn't know. And I think there's some really interesting opportunities with my clients today talking about, hey, we're about to hit the second wave, or we're in the midst of the second wave, but we're better prepared now because we have better management boards in place to help us really be able to make more informed decisions. So just really interesting to hear those reflections recently.
And I'm noticing all of our heads kind of nodding, and I think we've all been involved in conversations lately where it is less stressful. People are feeling more reassured that they actually do have a management system, and it's really allowing them to learn what they need to learn that maybe they, like PPE, for example, we really don't know what we have. And so that, but not having to do anything different, but just lean into the method more to understand. And I think about just the power of a single method shared across many people. Robbi, I remember early on when you were still supporting operations, you reached out to me and said, I've just been tasked with this strategic staffing work, and hey, do you have any ideas? And we just kind of bounced some ideas back and forth. And I think it's that power of collaboration across a system that is sharing a method. I think it also speaks to the trust we have within each other as teammates, that, you know, we have a shared method, and by working together, we'll come up with good options. Can you talk a little bit more, Robbi, about that, you know, the strategic staffing and how that not only was put in place, but had to immediately evolve?
Yeah, that's a good question, Chris. For me, my learnings with COVID were about the importance of going back to the basics. So as you and I talked about strategic staffing, we really had a conversation about understanding your demand, right? So the importance of where is the demand within the organization, and what are the skills needed to meet that demand. So we needed to set up processes to both understand the demand and also the skill set of our resources within the organization. And for us, the demand was how we looked at demand. This goes to Melissa's point. We thought we knew it, but we had to dive a little bit deeper. So for example, in some sections, they were seeing a huge spike in phone calls, right? So they knew their day-to-day phone volumes, but they really focused on the inpatient visits. But with COVID, the importance of rescheduling was a new piece of demand. The importance of triaging and setting up processes for virtual visits was a new demand for the team. So understanding that was critically important, because it wasn't always about the patient who was in front of you in person. It might be the virtual patient or the phone call triage or the surgeon who has to continually follow up with a patient whose surgical case has been delayed because of PPE shortages, right? So you had to understand your demand ways and then work across departments, right? And think of our team as a resource. So for example, the clinic set was working with the hospital to do contingency planning. So what are the skill sets of the nurses who are in the clinic, and what can they do to help support the hospital if we did see a significant surge, right? So that contingency planning had to go on, but you had to understand at a nurse by nurse level his or her skill sets, right? And then the hospital needed to know where they could use those resources and what the type of need will be. So those connection points were really important, is understanding it on a department level, an organizational level, and then with across departments was really important.
You know, and Melissa, you talked about the importance of PPE, and Val, I know that that was a real operational concern for the organization, especially in the hospital, with this, you know, the trajectory for many patients who are very ill were the critical care unit. So having enough PPE, not just the like ventilators we've heard a lot about in the news, but just the basics of having the tools to do your work. And I know that there very quickly over time we developed you know, like a supply and demand calculator, or just a daily dashboard to say, based on where we are, we have these needs. Is that something that's still in place with the hospital, Val?
Yes, demand and capacity is based on the flow of patients that are coming into the hospital. And as many of you all know, we don't know exactly how many are going to come. So what we developed was a demand and capacity based on conventional, contingency, and crisis, and looking at the volumes of what that would mean, which would then relate to the number of COVID patients that are positive, the number of ones that are infectious, and the places that you need the PPE and the resources to support the patients. And I think about where that was developed in the hospital command center. And taking a step back, the leadership in that command center was executive and administrative leadership with very strong BMPS skills to develop visual controls, to actually collaborate with analytics to develop models and those pieces. And then the Kaizen promotion office providing that information. It was really, really kind of chunky at first. We just had pieces of paper on the wall. But now today, every day, we get a projection of how many cases we have today based on what's happening in the region, if it's going to be low, medium, or high. So like for today, we have 11 patients in the hospital, 171 cases in King County, and we can project where those patients are going to fall in conventional, contingency, crisis, which then relates, Chris, to what you're saying as far as what are the resources, be it the people, the space, or the PPE. And the PPE team was very integrated, and it's just amazing to see the tools that they utilize to both manage demand and capacity, and also manage donations to figure out how do you utilize those different tools that you think are right, but probably aren't the right one to use. Once again, it's that big part of the management system that you were talking about, Melissa, about demand and capacity and being a step ahead of the game with leadership that understands how to apply those methods.
You know, it feels like for the 7 months now since things started to shut down in the Seattle area. And it feels like every day is a lesson in the importance of understanding all of the flows of medicine. You know, the patient, the family, providers of all levels, supplies, medication, information, equipment. And, you know, we have this graphic that we teach from that has the flows of medicine as a DNA double helix. And I think we've all kind of felt that importance of it's not one thing ever, it's many, but it's the one method that we have to lean in. We do have a question from one of our friends in the UK about, and I think this goes back to what we were talking about with respect for people. It's the, just some insights on maintaining a positive speak up culture. And so, for us, one of our 10 elements of respect for people is speaking up and listening to understand, walking in the shoes of others. So I'm wondering if you just each want to, we'll start with Melissa, since you do quite a bit of work in the UK. What thoughts do you have or advice would you give about the maintaining a positive speak up culture in times of stress like we are all going through?
Yeah, I know there's been a lot of work in the NHS as it relates to the Speak Up Guardians and really trying to inculcate that environment where it should be safe to be able to say, hey, on a minute, I think we might be embarking on something that might be dangerous for the patients, might be dangerous for our team. And so how do we continue to really support that type of culture? And I think one of the things that we have to acknowledge is how do we embrace the fact that those are really those early signals of something that might be going wrong in an organization, and it's the 1-2 little data points around the trust or your healthcare system that we need to be capturing. And so if we can kind of change our mental model of, oh, going from, it's that person who just is always complaining, is always talking about what's not working, to hang on a minute, this person might be the early detector of a huge root cause problem that is going to really just shut down the entire organization. So what an incredible opportunity to have a good catch and be able to avoid something tremendously dramatic to the organization. So I think considering ways of maybe encouraging speaking up, whether or not that is through through celebrating people who mentioned something, offering tickets of applause or what have you, or if it really kind of in our scenarios, if you have a culture already of continuous improvement, that participatory nature of, hang on a minute, I get to speak up and I get an opportunity to actually solve the problem too. How incredible will that feel to have ownership of taking care of our patients? So I think there's just a couple of different ways to really support that speak up culture.
Yeah, and I think the value when people feel empowered to speak up and share, really, Val, you talked about how something that's very systematic now, this tool of understanding demand capacity, it started with ideas, and then it became pieces of paper and quick sketches, and then you did it. It's the ultimate PDSA, right? But it's that importance of starting with the idea. And we talk about improvement, that the greatest currency we have is not the money available to us, but the ideas. Ideas are our currency before anything else. And that culture of speaking up really invites ideas to come forward. Robbi and Val, I'm wondering, you're newer to the outward sharing of resources with our clients. So you've kind of in your transition year, last couple of years, kind of doing both. I'm wondering, what has been your experience in working with clients? Do you feel that you're encouraging them to listen to their teams more? What's the speak up culture aspect for both of you? Robbi, why don't you go first?
Sure. When you talked about our flows of medicine and the double helix that connects the flows, I think about something similar with our respect for people behaviors. A speak up culture really starts with a leader who's sharing information, right? They're sharing what they know, and they're also sharing what they don't know. That's a critically important piece of being vulnerable as a leader, is sharing what you don't know, especially in terms of crisis. So I think the importance of sharing information, and also the importance of listening to understand, right? So as someone shares a concern, there's the concern that they're saying, but you have to really listen to understand it, because there may be a couple more layers underneath that, right? So talking about the importance of understanding what people are going through individually, right? There may be concerns around safety that they're expressing, but they're not saying it. So you really have to ask a few clarifying questions, really dive into what they're really trying to say, because those three are connected. The importance of sharing information, listening to understand, creates that culture that allows people to raise a concern because they know it's going to be listened to. But speaking up and people feeling comfortable with that doesn't just happen. It happens because you focus on the other 9 foundational behaviors of respect for people.
So Chris, do you want me to respond, or do I come? So in my work with about 2 or 3 different organizations with VMI, the beauty of is that all of them are integrating respect for people concepts, listening to understand, walking in other people's shoes, all those elements, and they're integrating it with their management training. And I know that others have heard at Virginia Mason, we didn't do that early on. In fact, the respect for people concepts came later. And if we were to do it over again, we would have done it earlier, but it was just part of our learning journey. So I think that the blend of the respect for people and Kaizen just kind of continues to get back to that idea that you listen to the people. They are the ones that know the truth. That's where the truth stands. So I feel that that's a key piece. And in reflection, I have to take a moment to go back to the question that Melissa answered. with the crisis, I know that when we did debriefs with different organizations, they with command and control and the speak up, and how do you balance that? Because in a crisis, you do need a little bit of command and control, but then how do you bring that together? And as the days went on through huddles and sharing ideas, it's getting back to it. But at the beginning, it felt a little uncomfortable because it was a little bit counter to that. So with the debriefs that we did with our clients, which is, the Hansai, Toyota, it was a way to kind of reflect on that and think about how do you do a better job with that and be a learning organization. So I just wanted to weave that in a little bit there.
I think that's and that's such a great segue to another question that we had from another one of our listeners who sent in early. I also want to put in a plug that we are seeing your questions come live, and we will be opening up for questions, but as I see them coming, I'm trying to work them in. So please make use of your question tool on the web. We are listening. But this idea of command control, which is old leadership style versus more of the leader. We teach our leaders through the Institute when we interact with our executive teams to be problem framers, not problem solvers. So come with the method, help people frame their problem, but don't solve it for them. Let them use the tools and methods to come up with those solutions. Have you found that in working with some of our clients that there's the test of whether they're really learning is, will they lean into the method or will they go back to their old habits? And I'm just wondering if any of you have had an experience where you've seen them really lean in to the method, even if it's brand new for them. Has anyone had any experience there?
I've been working with a brand new client in the UK, and we're trying to teach them on a every week basis. So we have about 60 to 90 minutes with the group every single week. And we create coaching opportunities also. So basically twice a week, we have a formal session and then an informal coaching. And we're seeing people come to the coaching sessions with these practical applications that we've asked them to look into and apply to their work, just going full on and really deep into using it. So we had a provider who went into a challenge that they were facing. He had his waste walk completed. He looked at his flows of medicine, and he really needed some coaching about how do I take this information forward. So we emphasize the importance of understanding your current state first. And so we coached him on the importance of, this is the first step in understanding your current state. There's more steps that we have to go. So we walked him through what that could look like. And then we talked through the importance of getting the people who do the work around the table so they can hear this information, and then you can work with them to come up with a solution. So for example, there was a process where the patients were coming in and checking in the clinic, and there was a challenge there with screening certain information. And so he brought that whole team together. And that one piece of request from the provider to that team that they come up with a solution was mind-blowing for them. It was transformational for a small clinic where that's never been done before. So those small steps of giving people the kind of different way of looking at it really makes a huge difference.
Great. So I want to shift our focus. We're moving into our second half of our conversation. And what a great segue to think about not responding to the crisis, but moving through and kind of establishing what, for lack of a better term, the new normal is with organizations. I do want to point out that we're getting questions about the topics we're talking about. So I think that's great. And I just want to remind people that if you go to the virginiamasoninstitute.org and in our search bar, put some of these topics down, you'll find blog posts from all of us. Melissa, you have a very recent blog post. Do you want to talk, just to give us a brief commercial about that blog post? Because I think it's relevant to our conversation.
Yeah, so I published a blog post just last month, I think. It's really kind of tackling, I suppose, the mental model that we all have that Kaizen can only be done if you're on the Gemba, if you're on the shop floor and you're touching the things that you need to touch. It that is part of the process. And I think for some of us, that's created a little bit of paralysis, right? So do we just not do any of our Kaizen events at all? Do we just cease all the RPIWs or rapid process improvement events until we can physically be next to each other? But we've seen, certainly for us personally at Virginia Mason, but also with some of our clients who've been really bold and have really leaned into their management system and realized that you can still do improvement work, and you can do it socially distanced, and you can also take full advantage of what we have with 21st century technology to make it easier to do improvement. So the blog post gives you a couple of tips and tricks on how to take it full advantage of that, because Kaizen stops for no one. We've got waste to eliminate like no other, so we just got to keep going.
It's funny, Robbi, Val, and I, we've had a chance to help an organization design a new ambulatory surgery center for orthopedic care. And normally we'd say, we can only do this by being on site with you and working with your team. And we had two provocations. They hadn't hired their team yet because this is new work for them, and COVID-19 wouldn't let us be on site with them. And yet we managed to do a lean facility design work virtually across 5 states. And, that was a pretty amazing experience to get out of our own comfort zone and really just trust our own processes. So again, a reminder, search on the topics and you'll find lots of the things that we're talking about. We have a great question from one of our listeners, and it's, what have you learned in the last 6 months? Both, because I think we've all supported work at Virginia Mason. I know I've led a couple improvement events, helped design a new clinic. Even in this time, we still found a way to come together. We've been helping break some of the barriers about really moving into virtual care delivery, not just as a stopgap measure, but the way we'll do our business going forward. So, what are some of your lessons learned over the last 6 months with COVID-19? How about we start with Robbi, then Val, then Melissa?
That's a good question, Chris. I would say my biggest learning is the importance of going back to the basics and applying them in new ways, right? Our demand is changing, so we have to apply them in new ways. I'm thinking through the request that our executive director, Sarah Patterson, gave, was because we were seeing more demand for our virtual delivery of our APing. She wanted to bring a team together to get ideas about how we could continue to add high quality to the participants, but continue to meet the demand. So within about a 10-day period of this becoming a challenge, we brought a small team together. I led them through a 3-hour idea generation session, which allowed us to then start to plan out how we might use some of these ideas. So it was 3 hours. We used some key principles that we would use in a production preparation process, which is a formal process of reinventing our services, but we applied it on a smaller scale. So really, again, going back to the basics, what's the challenge? What can I use within the Virginia Mason production system to address this challenge, be it key principles of innovation or basics of 5S. We've been talking with a number of our clients about 5S and the importance of understanding them. We talked about demand and capacity. So that's a key learning for me, is going back to really that base knowledge and looking how you can apply it to this new challenge, because the challenges are always going to come. And so our base knowledge is a great place to start.
Mm-hmm. Val, how about you?
So I think that a lot of what you shared, Robbi, I would agree with you, because the system is just a gift. And so for me, what I've learned is that the management system is a gift for you to continue to move forward And I remember way back when Chris, Robbi, and I were way back when at the beginning with Virginia Mason, that whole idea of fail forward quickly and just be nimble. I have to admit there have been times when I've been really uncomfortable. Like when we did that 3P, I thought, you got to be kidding me, doing a virtual 3P. And then it's like, wow, it's great. So it gets your greatest creativity out with the management system. And then I've really appreciated the importance of some of those respect for people listening to understand. And with the people I work with across the country, to really listen to them. And even though it's virtual or not present, to really understand where they're at and how to move forward using the management system. I just listened to hear Gary's voice at the beginning where he talks about the silver lining and the fact that the system helps you move through. And it's something I take for granted. It's been a part of my leadership for the past 20 years, but it's such a gift.
Mm-hmm. Melissa?
Yeah, so there's one thing that just keeps on coming back to me over and over again, and it's that it's no better time than right now to reevaluate and redefine value in a post-COVID world. So I think we've had these mental valleys and preconceived notions, and I think industry-wise or whatever health system that you're operating in, we've had these very specific ideas of how you can deliver care, or where that we're going to get paid in order to do this care, etc. And to some extent, I think given the urgency of a global pandemic, we've had some gifts that come with that silver lining. And so there's now an opportunity for any one of us to kind of say, what does the patient actually value today? Because I can guarantee to you that it's so very different from what it was 8 months ago. Virtual visits is the easiest example, right? We had a preconceived notion that you had to go to the doctor's office, you had to go to the hospital to see your physician or your provider, get that consult, and then maybe move forward through the rest of the process. And now to think that a lot of that type 1 waste, the assumption that you had to drive, you had to go find a parking space and all those things, completely out the window now. So what else can we do to apply those similar ideas? We don't have to make decisions by committee anymore, because turns out if you use the process, if you actually used your management system, you'll probably actually find the best solutions out of it. And so how do we embrace that accelerated decision making, but also ensure, to Robbi's point, let's make sure that we're using the basics. Let's make sure that we're using our tools and understanding the current state so that we can create a way better future state for ourselves. So.
I think, from my point of view, I think the thing that I've spent a lot of time reflecting after having conversations with clients and with my teammates is, prior to COVID, we dealt a lot with either or situations. And we spent a lot of time justifying the either or the or defending, and now it feels like in this sense of urgency, it's both and. We have to continue running the business and we must respond to COVID, but we have to keep our doors open because people still need our services. And I think the challenge of the crisis has allowed us to see that, when we focus on, to your point, value, Melissa, you talked about value, value talked about meaningfulness, what do patients value, what matters to our people, is there a way of igniting curiosity and excitement in doing something in a new and different, better way? I think that we start to see that we've always had what we needed. We didn't have to create anything from scratch. Our method was always there. It's just we learned so much by leaning into it through this period. And I think going forward, I think one that I've been spending a lot of time with my clients lately, kind of reassessing strategic priorities, because it's not going back, it's going forward with more challenges than you had before. People are trying to get back on their feet financially, opening the doors. So flow, clinic flow is so important now, which to me means, it's about you know, what type of access are patients asking for, but also what's the waste that's keeping them from that access that they desire. And sometimes it's the mental valleys we all have. And we're going to go back to doing clinic visits and scheduling things versus we're going to interact with our patients. We're going to deliver, we're learning that. We're delivering services virtually that we used to do, you know, in person. We've completely restructured our advanced training to real-time virtual engagement, and people are responding well to it. So if you had advice for people listening, without taking their eyes and ears off of what's happening with COVID-19, what advice would you give to people as they continue to move forward? And Melissa, how about you start, and then Val, then Robbi.
Put me on the spot, Chris.
I was trying to look to see who was lit up the most. You know, it's where we're learning with this virtual environment. It's how what you see really affects your next step. So go for it.
I'm gonna go high level. So, and it was just because you reminded me of it as you were talking, Chris. I'm hoping that what we can learn from this pandemic and what we can take forward and not let go of that feeling is that this global pandemic has taught us that changes are happening every day. We get new information every single day. Masks, no masks, aerosolized, not aerosolized, who knows what it is, but there's always this constant change in the environment. And so I'm hoping that for all of us, as we think about what we can take back and continue to improve our own healthcare organizations, is that change is always happening. And so embrace that opportunity to improve what you know today. Because if you don't, and I think the pandemic made it super real for many of us, is that if we wait until the dust settles, people die, right? And so there was that sense of urgency that really created that hyper-focused staff in all of the organizations that we've been working with amongst our clients. And so how can we use that idea of things are always going to be changing, so don't wait to make it perfect. Don't launch a year-long process to design and plan something out, because who knows what will happen from there. So I think many of us constantly use the quote of "Don't let perfect be the enemy of the good," and I think hopefully we'll have embraced that truly from the pandemic. Because gosh, if we had all waited, I can't even imagine what the toll would have been globally for all of us. So let's continue with that idea.
Yeah, I'm smiling about that, Melissa, because in the first, so 60 days after we realized that we couldn't deliver our services the way we had planned for advanced training, we offered a new program. We used our own method. We rapid cycle developed. We knew it wasn't going to be perfect, but we did it. And we delivered. And one of the first attendees in that first cohort was keeping a phrase book of all my isms. And it was funny, she not only categorized them, but she actually quantified how often I said certain things. And the one thing that I said over and over and over again was better is better. You know, and it's kind of like that, you know, it's the partner to the quote you were sharing about perfection is the enemy. It's better is better, folks. And I think that's what we have learned is just, you know, we have to do something. Let's do something. It will be better and we will learn. So Robbi, how about you?
You know, I was writing down the importance of the PDSA cycle, and this kind of goes to what Melissa was talking about, is truly understanding your objectives. I have a client in the UK, and they were working through this process of a referral coming from a primary care team to a specialty team, and they were looking at the referral process, and the general practitioners weren't sending the right information in a timely manner. And we just talked a lot about what's the objective you're trying to achieve versus this one specific process that you're attacking. Because you think that that's the process, if we just fix that, we're going to be fine. And so we took a step back, and the objective was timely quality care, right? So the objective was they wanted timely care, and this referral was an important piece to them. And so we just talked about own the objective, don't own your perception of the solution. The solution in their mind was, we just got to fix this referral process.
Right.
But they need to own the objective, which is timely quality care, right? Timely meaning we can contact the patient, quality meaning we have the right information in order to schedule them in the right way. So that was important to them. So taking that step back, and then just the importance of a plan, do, study, act cycle is, to Melissa's point, is try something, right? You're not going to have every piece of information you would like, but get a plan, try it out, study the results, have a change in your thinking, and either implement that new process or run a new plan, do, study, act cycle. So those are the two things that come to mind when you ask that question.
Okay. Val, before you share, I just want to remind people that we have about 5 minutes left for questions, so please keep them coming. We've slowed down a little bit in our question tool, so please use the questions. And Val, some thoughts from you?
So as I think about both what Melissa and Robbi said, I would concur with that. And then I think that what my advice would be is, as much as you can as you progress, to embed things in standard work. So some organizations are kind of keeping their incident command as a place where everything happens. And this COVID situation's here for a long time. So how do you embed things in operations and standard work rather than keeping it a response system in incident commands? Because some are still running the commanders have transitioned some of that to operations. Just that little piece. And then just one of the things that I feel I didn't say earlier is the role of leadership and the power of reflection and debrief. Many times to see about what you can do, what are the gaps, and how can you accelerate forward. A lot of people are choosing to say, I can't do Kaizen because of COVID. Well, the reality is there's so much waste, and there are areas where perhaps you can improve, where it might be the hot spot of where your organization is. So maybe reprioritizing areas to continue to remove waste, because there's so much, and organizations have to continue to perform at the highest level of excellence. So that role of leadership, reflection, moving forward, and then just getting things into standard work from the PDSAs that Robbi's talking about as well.
You know, I think about a recent blog post that I wrote about one of my clients who, at the time of crisis, said, the leader of the Kaizen promotion office said, this is our opportunity to really help our clinics. And they deployed the team out into the clinics. They did no new improvement, but what they did was they just helped the team understand all of the standard work that had been developed over the last year, because it was all designed to improve the flow in the clinic and to really think about what is the ideal patient experience. And that team not only maintained clinic operations, they actually grew their volume. And not just for COVID appointments, but others. And we have another client who did a 50-person Kaizen event once the shutdown in Massachusetts was lifted, to strategize how to get the clinics back open and operating. They went back to their standard work. So they started from their standard and they built upon that. But I think the thing that I'm left with is what comes out is the importance of connection. I was just on a coaching session today with a group that's envisioning what mental health services integrated into a trust hospital in the UK will look like. And they've just finished their work for the week. They did it all virtually. And the one thing that came out was the importance of the two teams who've always been separate coming together. And the thing that united them was what's in it for the patient. And then how do we really leverage the talents of the team? So that connection piece is really important. I think personally, I just appreciate the fact that you are all really smart people. And it's so great to not be alone with the problems. Like you plus the method coming together, we've done some pretty amazing things in this short term. I'm just kind of looking at the questions, just a lot of we're using a lot of our tools. And so just a reminder that all of those are on our website for further description. Val, you used a term that Robbi talks quite a bit about, and that's the concept of Hansei. So maybe Robbi, do you want to tell us a little bit more about Hansei?
Yeah, I would actually want Val to chime in also, but just the importance of reflection. These days that we have are really, really tough as we go through COVID, and we're constantly looking to meet the demand within patient care, but also how do we take care of ourselves during these tough times? Sensei is just about reflection. Val, what are your thoughts on that? You were really diving into that.
So as we know, the Toyota is where we start, and then how do we translate it to our organization in healthcare? And debrief is a common thing you do in many healthcare settings and carry off in others. But I think the key thing about Hansei is a commitment to being a continuous learning organization. And when executive leadership leads debriefs, it gets you a point of vulnerability about things that maybe didn't go so well, so that you can do an action plan and countermeasures to improve. It's just that continuous improvement about Kaizen. And so taking a pause and reflecting during this crisis time is really critical, as things are moving so fast. And it also kind of gets to that respect for people, listening to understand and making commitments and sharing information. So it's a very strong concept. Many of you have used it in your clinical areas, and it's just really a strong management tool to pair with your continuous improvement.
You know, Melissa, we're kind of nearing our close, but I think, you know, you and I are in two totally different cities on opposite sides of the country. You're in Boston and we're in Seattle for the most part. And, you know, one of my reflections is it's really easy to kind of be siloed and isolated dealing with your own problems. And yet this importance of connection, you know, and connecting to something is really, really proving to be our solution, our way through this crisis, getting to what will be normal in the future, because we just don't know. But we do know that there's work to do, and that there's opportunities for improvement. You know, waste never goes away. You know, I think we've all kind of talked about that, you know, waste didn't take a vacation when COVID hit. If anything, it kind of showed itself more clearly to us all, and we've been real active in removing waste and helping people see that, you know, waste is the enemy, but ideas are the opportunity in engagement. Tad, are you ready to take it back for closing comments?
Yep. All right. Sounds good. Thanks, Chris.
Thank you all very much. It's such a pleasure being a team member with all of you.
And that is all the time we have today for questions during this webinar. Thank you, Val, Robbi, Melissa, and Chris for the session. As stated earlier, this webinar is being recorded and will be posted on our website at www.virginiamasoninstitute.org under our resources section. You'll also receive an email with the link to the recording and the Q&A transcript following the session. We also encourage you to explore more content on the resources section of our website, which includes case studies, articles, and improvement tools. And be sure to connect with us on Twitter, Facebook, and LinkedIn for news, updates, and upcoming events. If you're interested in continuing your learning, we have a variety of services to help meet your needs, including virtual training, coaching, and organizational transformation services. You can learn more at our website. Again, that is www.virginiamasoninstitute.org. And you may also email us at info@virginiamasoninstitute.org. Thanks again, Val, Robbi, Melissa, and Chris, and to everyone who participated in today's webinar.